Hi, ladies. I'm here and we're going to go over chapter 3 tonight, talking about infection control. Okay, so infection is a cause, a condition, that results in microbe, which is microorganism. It invades the body, it multiplies and causes injury and diseases. Microbes include bacteria, fungi, protozoals, and viruses. A pathogen, a microbe capable of causing a disease. Now, a communicable infection is able to spread from person to person. Think the flu, the common cold, COVID, that type of thing. The CDC charged with investigation and control of the disease. Okay. The global spread of a disease. Now, an endemic is a disease that belongs to a particular area, people, country, and can be commonly found there. An outbreak is a sudden increase in cases of disease in an area beyond what is expected or the infection in a new area. If an outbreak is not quickly controlled, it can lead to an epidemic. An epidemic is when an outbreak of a disease spreads rapidly, affecting many people within a community, population, a region, or a number infected in an area significantly higher than normal. Now, a pandemic, we all saw that in 2020. A pandemic is when an epidemic of a disease has spread it over multiple countries or continents and affect large portion of the population. And we saw that with COVID. Okay. Now, a nosocomial and HAI, which is a healthcare associated infection. You need to know this. So go ahead and take out your highlighters and highlight this in your book. You need to know what a nosocomial infection is. It is when a patient is infected or acquires an infection in a hospital. Meaning, I went to have my tonsils taken out, but I ended up with pneumonia. Meaning, you did not go into the hospital with this thing, but then while you were there, you acquired this situation. Okay, so a patient infection acquired in a hospital is a nosocomial infection. Okay. A healthcare associated infection is when a patient infection acquired during the healthcare delivery in any healthcare setting. 1 in 31 hospital patients in the U.S. has at least one HAI. More than a million a year, costing billions of dollars annually. Okay? The causes is infected personnel, patients, visitors, food, drugs, or equipment. Now, as we get into the infection chain and stuff like that, we're going to get into how patients can become infected in the hospital. Okay. Antibiotic resistant infections are well established antibiotic resistant bacteria such as C. diff, MRSA, and Enterococcus. All right, if you ever come into contact with someone that has C. diff, you will definitely know it. C. diff has a particular smell. C. diff is actually bowel movement, but it is very, I guess the best way for me to say it is it has a particular smell. It has a particular look. If you ever come into contact with a patient that has C. diff, I highly suggest you down your PPE. Make sure you have on your mask. Make sure you have on your gown. Cover your shoes, gloves, the whole 9 yards, because you do not want to get sick from just being around them. Okay? So make sure that you're protecting yourself. A multi-resistant gram-negative bacteria is CRE, is CRE. You have different coli's, pneumonias, antibacterials, and pseudomonas. Okay, these are all multi-drug resistant gram-negative bacteria. Now, We're into the chain of infection, and if you look in your homework folder, there is a worksheet there on infection control that I will send to you all, just to make sure you have it, okay? So, number one, infection. That is the agent, okay? It's a pathogenic microbe responsible for causing the infection, okay? Then the reservoir is the source of the infectious agent. It's the place where microbes can survive and grow or multiply. It includes humans, animals, food, water, and soiled equipment. So basically what the reservoir is saying, hey, I'm a place where you can come and hang out. All right? This is the place where we can hang out and we can go from place to place. All right? So remember that in the hospital, when people are getting nosocomial infections, remember it can come from patients or staff. It can come from animals that people are saying that are support animals, food, water, and soiled equipment. Everything from the linen to the trays the food come on. If it's not clean, you can get infections from all of those things, okay? The exit pathway is a way an infectious agent can leave the reservoir host. Secretions and exudes, tissues, specimens, blood, feces, and urine. All right? These are all ways that our body can flush infections. So if you notice, most of the time when your doctor puts you on antibiotics or they're giving you some type of IV flush, what are you going to do? You're going to the bathroom. Why? Because you're either urinating or you're having bowel movements, and sometimes it comes up instead of out. All of these ways, and some people sweat. Let's not forget that. So when you're running a fever, most of the time you're sweating out whatever is going on in your body in order for you to get well. Okay? Number 4, you have to have a mean of transmission. What does that mean, Ms. Nyla? Thank you for asking. Infections just don't get to the person on its own. It has to have a way to enter your body, right? So airborne. So when we think of airborne, we're thinking about the cold, flu, COVID, tuberculosis, anything like that is airborne, okay? And then we talk about contact. You need to know what direct is. So direct contact is touching, kissing, hugging, drinking out to each other, that type of thing, okay? Now, indirect is dealing with contaminated objects such as your trays, such as your blood pressure cuffs, anything that you're sharing with other people, okay? That is indirect contamination. Then you have droplets. What is droplets? It can be coughing, sneezing. That's why we ask everybody, when you sneeze in your arm. When you're yarning, cover your mouth, because what's happening is you have droplets coming out of your mouth. And plus, it's just rude to to sneeze, and cough and go on in front of people, and you're not covering your mouth, okay? So make sure that we're covering where those droplets are coming from. Then we have what they call vectors. Vectors are insects, arthropods, and animals, okay? So a lot of people don't like roaches. Why? Because they're carrying different diseases, infections, all that kind of stuff like that. So we want to stay away from those type of things, okay? And then you have what they call the vehicle, which is our food, our water, our drugs, anything to that notion can get into our body, okay? So you might say, well, how is drugs included in that? Okay, well, if your nurse is popping the pills in a little cup, in a little medicine cup, and they didn't make sure that patient went on and took it, however, they sat there and let the cup sit there for hours, there's no telling if the cleanup people have came through and sprayed. I mean, there's nothing covering that medicine. And now here it is, 6 hours later, now Miss Susie is about to go ahead and take the medicine when the medicine should have been either put back up or covered. Okay? Those are ways. Now, entry pathways, still in the chain of infection, okay? The entry pathways is how an infectious agent enter a susceptible host. Now, you're going to say, Miss Nala, what is a susceptible host? A susceptible host is anyone with a lowered immune system. So you have your elderly generation, your children, your cancer patients, your people with lupus, MS, all that kind of stuff. These are susceptible hosts because these are people that already have a compromised immune system, okay? Including body orifices, mucous membranes, and breaks in skin, okay? So if you have someone that have deep cuts on their arms, their hands, these are all ways that infections can get inside the body. That's why it's important to you put some type of antiseptic on it and keep those areas covered, right? Again, we're already talking about the susceptible host. Okay, so someone with a decreased ability to resist infection. We just kind of talked about that. And then the factors such as health, immune state, and age. Okay, those are all things. Now, you might ask, how are we going to break the chain of infection? How do we break the chain of infection? Well, first, hand hygiene. Wash your hands, wash your hands, wash your hands. Anytime you're anywhere where you have running water and soap, wash your hands. Remember that sanitizer is for room to room, or you're just in a hurry and you need something. But when you have water and soap readily available, keep your hands washed. Medical personnel have some of the most dirtiest hands because they're not washing them. They're just in and out of rooms sanitizing all day long instead of using hot water and soap. Wash your hands, okay? Having a good nutritionist, a good diet basically, resting and reducing stress. Those are all things that help to break the chain of infection as well. Making sure that you have your immunizations. Decontaminate surfaces and instruments. You're going to always dispose of sharps, infectious waste. Use gloves and gowns and masks and respirators when needed. Needle safety devices. We never want to use needles that don't close, okay? Infection control programs. Know what your program is for your area. Make sure that you're cleaning up so you don't have insects or rodents or anything like that. They do carry diseases, okay? And then you have your isolation procedures. If you go to a patient's room and they have that bag on the door for you all to gown out or dress out, do so, okay? Those bags are not there just for decorations. They are there to keep you safe. They're there to keep you where you don't catch whatever they have going on, all right? A phlebotomist whose duties involve contact with many patients must fully be aware of the infection process and take precaution to prevent the spread of infection. The number one way to do that is wash your hands, wash your hands, wash your hands. Okay? An infection control program is to protect the patients, employees, visitors, and others. To break the chain of infection, you're going to monitor, collect data on all infections occurring in the institution. Institute special precautions in the event of outbreaks, and the components would be employee screening, employee immunization, evaluation of treatment, and surveillance. Infection control practices: wash your hands, wash your hands, wash your hands. Use an alcohol-based antiseptic. Make sure that it's at least, at minimum, a 70% isopropyl alcohol, okay, sanitizer. A lot of us go to Bath and Body Works and Victoria's Secret and all these places, and that's not real hand sanitizer. So make sure that you're getting something that at least has a 70% isopropyl alcohol in it, okay? And again, wash your hands. They're going to keep saying this in hand hygiene. Wash your hands, wash your hands, wash your hands, okay? So now, personal protective equipment. The abbreviation for that is PPE. I suggest you highlight it so you can know what PPE stands for. In PPE in our case is gloves, gowns, lab coat, mask, face shields, goggles, and respirators. You will see and what is this? They have an area in your book where it talks about glove removal. Gloves used do not replace the needing of hand hygiene, okay? So what that means is just because you had on a pair of gloves, it doesn't mean you don't have to wash your hands. I'm here to tell you, you still need to wash your hands, okay? Make sure that you're doing that. You're going to sanitize hands immediately after glove removal and before going to another patient, back to the lab, and before performing other duties. Make it a habit to keep your hands clean, okay? Figure 3-2 shows you a N9 respirator. If you decide to work in any hospital, 90% of the time they're going to get you fitted for an N9 respirator. And what most people do is just leave it in their locker at work, okay? If you go on, they talk about the order of donning for a PPE. The first thing you will put on is your gown, your mask or respirator, your goggles and your face shield, and then your gloves. Now, the way you would take that stuff off is your gloves, your goggles or face shield, your gown, and then your mask. Make sure that you're only touching the strings of the mask and not your face, okay? You might want to just make yourself familiar with how to put on PPE and then how to take it off. Okay. Now, we talked about this yesterday. We kind of got into this conversation on yesterday where we talked about asepsis is a condition of being free of contamination or germs that causes disease. Now, that's asepsis. Okay. Aseptic is free of disease-causing microbes. Aseptic technique is a practice used to reduce the chance of microbe contamination. Aseptic technique for blood collection personnel, proper hand hygiene, keep supplies within reach to avoid dropping them, opening packages in a way to avoid contamination, prompt and safe disposal of contaminated equipment, prompt cleanup of infectious material, wear gloves for blood collection, and other PPE when indicated. Okay. In ICU infection control plans, keep your hands washed. Make sure you have on clean gloves. You'll gather the necessary supplies and leave blood collection tray on the outside of the room, okay, or the nursery. Remove your gloves, decontaminate your hands, and put on new gloves between patients always. Never go from patient to patient with the same gloves, okay? Isolation procedures overview. Keeping patients within communicable infection spreads from others, okay? It spreads infections. It prevents the spread of infections, and it protects the patient with compromised immune system. Isolation requires a doctor's order. They can't just isolate patients, okay? And infected patients is confined to just that room. Isolation procedures. Protective reverse isolation is for patients that are highly susceptible to infections. Those are your cancer patients. Those are your HIV/AIDS patients. Those are people that have a very, very compromised immune system. Sometimes you will find out that they are in something what we call reverse isolation, meaning we're putting them in isolation to protect them from us. Okay? Universal precaution, which is up. It has blood and body fluids for all people are potentially infectious. Remember the other night when I told you treat everybody like they have something. Everybody got something, okay? And that's how we have to govern ourselves when we're dealing with these patients. Body substances isolation, and it goes beyond universal precaution. Gloves for contacting moist body parts substances. Okay. Now, guidelines for isolation procedures. The standard precautions you're going to use for all patients. Everybody got something. That's standard precautions. Number one strategy for control of a nosocomial infection: covers the blood and all body fluids, skin breaks and mucous membranes. Updates added: the respiratory hygiene and cough etiquette. Transmission-based precaution: use the patients known and suspected to have certain infections. There are 3 different types. We just went over them, but I'm going to say them again: airborne, droplet, and contact. Right? If you look at figure 3-8, that is our biosafety symbol. Okay, biosafety, biohazard, all the same thing. Okay, any material or substance potentially harmful to your health, I will be always identified with this biohazard symbol. Biohazard exposure routes: airborne, ingestion, non-intact skin, premucances. I think I'm pronouncing that right. That means through the skin, and premucosal is through the mucous membrane. Biosafety. So bloodborne pathogens like hepatitis B and hepatitis D. The best defense against HBV is vaccination. And HBV exposure hazards are presented in the blood and body fluids and can survive up to weeks on objects. Weeks. Okay? It's transmitted through needles and sexual contact. The symptoms are flu-like, fatigue, loss of appetite, mild fever, muscle, joint, and abdominal pain, nausea, and vomiting. Hepatitis C is exposure hazard. It's present in the blood and the serum and sometimes in saliva. Infections primarily occur after large or multiple exposures. Okay? It's transmitted through needle sticks and sexual contact, and you will have the same symptoms as hepatitis B. Okay? HIV is present in the blood, the semen, the saliva, your tears, your urine, amniotic fluid, breast milk, cervical secretions, and tissues. Risk to HCWs is primarily through exposure to the blood. And symptoms when it starts to progress are flu-like, white lesions on your tongue, different sarcomas, neurological symptoms, and sometimes even dementia. OSHA is bloodborne pathogens. It's enforced by federal law, and it's intended to reduce and eliminate bloodborne exposures. It requires engineering a workplace control to prevent exposure incidents. Always have PPE available. Make sure that your employees are trained. If they need special training, that is readily available. And medical surveillance as well. Also making sure that everybody has had the hepatitis B vaccination. Okay, and that needs to always be available to anyone working in the lab or with blood or body fluids. Okay, needle stick prevention. There's always a revision and updating the exposure control plan. That means what you should do after you have had a needle stick. Solicitation of employees' input in the sectioning of the engineering of the workplace practice controls, modifications of engineering definitions, and new record keeping requirements including the requirement to keep Sharp's injury log. Exposure control plan, it always must be written, it must be reviewed and updated at least annually. Non-managerial employees with risk or of exposures must be involved in identification, review, and selection. Bloodborne pathogens, exposure routes. Again, it can go straight through the skin by contaminated needles or sharp objects. Blood or body fluid splashes in the eye, the nose, or the mouth. Blood or body fluid contacts the skin through scratches or abrasions, and human breaks in the skin. If you've had a needle stick, always carefully remove the shards of glass or other objects. Wash the site with soap for at least 30 seconds. I would highlight that. I have known that to be on your certification, okay? Mucous membrane exposure. Flush the site with water and sterile saline at least 10 minutes. Use eye wash station if available to flush and splash to the eye. Remove contact lenses immediately and disinfect them. I don't believe in disinfecting contacts. You better throw them away and just get a new pair, okay? Report the incident immediately to your supervisor and report directly to the provider for evaluation, treatment, and counseling. They'll tell you what to do from there. The surface decontamination. All surfaces in specimen collection processing areas must be cleaned with a 1 to 10 bleach solution or other EPA approved solutions. Cleanup of body fluid spills. The EPA approves chemical solutions and a kit. The gloves must be worn and absorb material without spreading it over wide areas. The biohazard waste disposal. All or none reusable items contaminated with blood or body fluids to go in the body biohazard container. So anything with blood, fluids, urine, feces, that stuff is going in the biohazard container. Okay? Has to. All right. So when we think about chemical safety, it's a general rule to always wear your PPE. Clean up the chemical spills properly. You never want to store any type of chemical above your head because it may fall, and if it falls, it might hit you dead in the face, so it might get in your eyes, okay? You never want to add water to acid. Sometimes, I'm just going to tell you, sometimes when we're at home, we go to mixing Fabuloso with ammonia or with Clorox, and we go just to mixing stuff because we think it's getting cleaner. Please, let's not do that, because doing that sometimes you can cause chemical burns and all other kind of stuff. So let's not mix chemicals, okay? Don't ever pour chemicals either into dirty containers. You can start fires. You can have all kind of stuff. So let's not do that. Okay, and let's not use chemicals in a way that they were never intended to be used. Okay, don't sniff them, none of that. Okay, let's not do that. OSHA hazard communication standards, HAZCOM labeling requirements. It states that everything such as any type of chemicals or anything, it must have a warning symbol on it. You must have a hazardous symbol on it, and also it's a precaution to eliminate the risk. First aid measures for spills or other exposures. It should be readily available in any lab that you work in. And your safety data sheet, anytime that you're ordering some type of chemical or anything, you probably always want to file back that chemical that safety data sheet just in case. Figure 3-14 shows us a DOT hazard material label, and it just points out what each area means on that label. Okay. Same thing with figure 3-15. That's the National Fire Protection Association labeling system. You will see this normally at the wash station if you work in a lab. If you ever get anything in your eyes or anything like that, right there at the wash basin is where you will see that. They also have this chart here, the National Fire Protection Association. You can also look at that too. I kind of got ahead of myself, but we are looking at figure 3-12. It is the eye wash basin. If you ever get anything in your eye, it almost looks like a mini water fountain. You would want to get there immediately and wash your eyes out. The phlebotomist should know the location of this machine in every lab that they work in, okay? We use it for chemical spills or splashes to the eyes or to the body. You always want to flush that area for at least 15 minutes and visit the ER for evaluation. Now, a spill cleanup kit is for any type of chemical spill, blood spill, anything like that. It's giving you everything you need so you can discard of any of that material in a safe manner. Electrical safety. We don't do a whole lot with electrical safety, and some of this stuff is kind of redundant, but we're going to go over it here a little bit. Anytime you're having issues with electricity, you always want to make sure that you shut off the source of electricity. You can't shut it off. Use a non-conducting item to remove the electricity source from the victim. Call medical assistance, start CPR if needed, and keep the victim warm, because going through those type of situations, they may be cold at that time. All employees should know the procedures in case of a fire. You should know where to find the fire extinguishers. If we have fire blankets, you should know where those are, and you should be able to locate the emergency exit for evacuation routes, okay? All right, so the components needed for fire is fuel, heat, oxygen, and chemical reaction. So fuel is a combustible material. Heat is the temperature of a material until ignition. Oxygen is to maintain the combustion, and chemical reaction is to produce the fire. Keep the components apart to prevent the fire. Okay. Figure 3-20, it also shows you the fire triangle is what I like to call it. There are different cases of fires. You have class A, B, and C. Class A is just a regular fire, wood and paper. You'll use water to extinguish that. Class B is flammable, paint, oil, grease, gas, that type of thing. You would more so need oxygen or a smothering extinguisher for that. Class C is electrical equipment. Anything that plugs in or something like that, it will require a non-conducting agent to extinguish that fire. You have Class D, which is a combustible reaction metals like sodium, potassium, magnesium, and lithium. Okay, it requires a dry powder agent or sand to put those type of fires out. Then you have Class K. It's a high temperature cooking oil, grease, or fat. Okay, and it requires agents that prevent splashing and cooling and smothering. All right. We are at figure 3-22, talking about radiation. Now, anytime we go into the radiation department, we want to make sure that we don't stay too long, all right? Our bodies do not do well with a lot of radiation, and they do not give phlebotomists the little bar to put on your name tag that most therapists have in that department. But you need to know that this symbol, figure 3-22, is the symbol for radiation hazard, okay? So the principle of radiation exposure is distance, shielding, and time. The radiation is present when the patient is injected with radioactive dyes, the specimen from radiology or the nuclear medicine, or the radioimmunoassay lab area. All right. Now, if a patient is hemorrhaging, abnormal or profuse bleeding, the treatment is to firm direct pressure to the wound using a cloth or gauze. Elastic bands can be used to hold compression in place, and only use a tourniquet as a last resort. And if a person is hemorrhaging or something like that, make sure that you're not taking the towel or the gauze off and replacing them. However, what you need to do is continue to pack on gauze right on top of it. Okay? Never take them all off, because what you'll do is you'll stop the clotting. Okay? And if we're holding pressure, we're trying to get that area to clot. Right? If a patient goes into shock, shock occurs when insufficient return of blood to the heart results in an inadequate oxygen supply to the bodies or the organs or the tissues. The cause is hemorrhage, heart attack, trauma, and drug reaction. Some of the symptoms are pale, cold, clammy skin, rapid or weak pulse, an increase to shallow breathing rate, and an expressionless face and staring eyes. If a patient goes into shock, this is what you should do. Always make sure that the patient's mouth is open, that the airways are open. Call for 911, call for help. Keep the victim lying down. Elevate the legs so that they are higher. Elevate the legs so the head is lower than the body, unless doing so will cause further pain or injury. Attempt to control the bleeding or the cause of shock, and keep the victim warm until help arrives. Okay? If the patient is going through a stroke or having a stroke, you need to know that strokes are a leading cause of death and serious disabilities within adults. It's best if it's diagnosed within 3 hours of the symptoms or the onset. The signs of a stroke is sudden numbness and weakness in the face, arm, legs, especially on one side of the body. If you have sudden confusion, trouble speaking or understanding speech, have sudden trouble seeing in one or both eyes, suddenly trouble walking, dizzy, loss of balance and coordination, and suddenly severe headaches with no known cause. If a patient is having a stroke, always remember this memory jogger for the signs of stroke, and it is fast. Face drooping, arm weakness, speech difficulty, time to call 911. Fast. CPR, I really don't get into CPR because we have a CPR instructor that comes in and does that class with you guys. So we're going to move on through that, okay? Let's go on down to where you see the pyramid with the fruits in it. Remember that it's not just what about you eat, but it requires a holistic approach, one that meets the physical, emotional, social, and spiritual and economic needs. This is figure 3-24. Proper nutrition is important for those of us that work in healthcare. We need to make sure that we try to avoid processed starchy food, have a balance of carbohydrate, fat, proteins, vitamins, minerals, and fibers, okay? We need to make sure that we're also getting our rest and try to exercise. And I get it, guys. Life is so fast moving and there's always something to do. So no, we do not eat our best all the time, and we really don't get moving the way that we should. But I challenge each and every one of you to try to take at least one day and try to eat better. Try to get a little walking in to see if that will make a difference in your life, okay? Now, personal hygiene, always take a shower, y'all. Take a shower, get a bath, use deodorant. Make sure you're not using anything that's heavy scented, colognes or anything like that, because when you're working with the public, some people are allergic to certain things, so we just want to be aware of that, okay? I always want to make sure that you brush your teeth and use mouthwash several times a day. We are right in people's faces, so what I used to do is I always kept me a little travel toothbrush, mouthwash, just in case, especially after lunch, so I could just kind of freshen up before I went back out to work. I always make sure that your hair is clean and neat, and that your fingernails are clean, short, and neatly trimmed. Back position protection. Always make sure that you're using the proper techniques when picking up heavy objects. Stress. Listen, y'all. Stress will cause your immune system to break down like no other. You'll have issues and problems that you've never had before. So let's make sure that we're keeping our stress level down. We don't want any type of high blood pressure, migraines, nervous breakdowns, those type of things. I'm here to tell you, when I worked at LabCorp during COVID, that was one of the hardest times of my life, mainly because it was so stressful. On top of home life, on top of working outside of there and teaching and all of the things that I was doing, I always suggest to you all, always take out time for you, no matter what. Me first. Always remember you first. This has been chapter 3. Make sure that you go over your infection control worksheet, and we will see you all on Monday. Have a blessed day.